So, how difficult is it for psychiatrists to transition out of clinical medicine?
I think that is a really good question. I think particularly in the UM space because typically psychiatrists are just reviewing behavioral health cases. So I feel like the opportunities are smaller. I do find that when people get their utilization management jobs, they keep them. There's not a lot
Mhm.
of they don't the
Turnover.
openings don't come
Mhm.
open very often. And as you know, in this space, like sometimes like your licensure really depends. So it may just be if you have a California license or Illinois or
Mhm.
whatever. And because they are so scarce, it can be a challenge. And I think like with my case, that was, I think, part of what took so long in the transition is finding the opening where your license fits. And then, and that they want a person or are open to a person that doesn't have like experience. So I know one of the interview processes that I went through where I was one of the final candidates, in the feedback I got, which also, and we may talk about this at the end about interview process. I was lucky enough to get feedback, and it was really good feedback. But that was the feedback they gave me. They said, look, it came down between you and another person, and we chose that other person because they did have experience. And so I think finding the roles with your license and all this stuff, and you know that your experience that they will be open to you. So for me, I think especially for you specifically, that might be the challenge that I think the jobs sometimes can be few and far between. And that particularly if you're trying, I guess I'll say if you're trying to go with an established
Yeah.
company, there are some independent review companies that were, if you're doing part-time or kind of as a side gig, it might be
Mhm.
easier. But if you are trying to get with one of the larger, Magellan,
Mhm.
Elevate, Cigna, Humana, or something
Mhm.
like that, those openings do not come open very often. So you have to almost be kind of in the right place at the right time.
Yeah, and I would say to those people who have more than one licenses and are thinking of getting rid of a license or two and are considering a transition, I would say that's an asset to have more than one licenses and keep them until you have successfully, made your transition because you may be looked at more favorably for having more than one licenses.
For sure. Definitely for UM. Like since I've been here, I'm actually in the process of applying for like another license, like just since I started from April. So definitely in the UM space, having more can be seen as an asset.